Who says you can't figure out pricing when it comes to healthcare? Well, you can. And that is another healthcare secret we will give you today. Hi, everyone. John Daly here, along with Judd Anglin. Welcome to the Healthcare Secrets Podcast. And this is a good one that comes out of Judd's book called The Big Book of Healthcare Secrets. Now, if you have no insurance or if you have a high deductible plan, then you need to listen to this. Also, if you're involved in medical cost sharing, where you have to be concerned about your medical cost and how it is on your fellow members, then you also need to listen to this. Judd, let's take a look at the problem first. Too often in America, people go in to get a medical procedure and they have absolutely no idea what it costs. Why is that?
John, it's a great question, and it's a simple answer. The simple answer is they don't want you to know the price. Why? Because you're not paying as the patient. 80% of the people have insurance, and insurance is paying. So there is no reason to give you a price, and that way they can determine the price on their own and bill the insurance company.
There you go. And vis-a-vis why we have such high healthcare costs and not the best of outcomes as well. Okay, so let's say you have a high deductible plan. You need a procedure, but your insurance won't kick in until maybe you've paid $12,000. What do you do?
Well, in that case, it behooves you to shop. But how do you know how to shop? That's a very important question, right? How do you shop for prices in healthcare? I hear people all the time say, well, I don't know the price. Where do I start? Well, you can start with a little-known website called healthcarebluebook.com. In that website, when you go in, you can type in any procedure you're looking for, enter your zip code, the area that you live in, and it will show you the negotiated price that insurance companies have with hospitals across America.
Wow. And so that's almost like the car Blue Book, right?
Exact same principle. And it's a great little website. I use it all the time. When people contact me and they're looking for a price of procedure, as a consultant, I take them to that website, show them how to type the information in, and lo and behold, they have a price. Now, that, again, keep in mind, that's the negotiated price that the insurance company has with the hospital. So that's not necessarily the price you're going to receive, but that gives you a benchmark to start with. So when you contact your local hospital, you can tell them, I have the healthcarebluebook.com price. The negotiated price for the hip replacement is $22,000. That's the price I'd like to get. Can you do that?
Okay. And we should also tell people, too, if you're a self-pay patient, your costs are going to be less than what the insurance company has negotiated. So you will get a lower price than that, right?
That is correct. That's another thing. You always want to say, when you contact a hospital for a procedure, you want to let them know that you're cash pay. Okay.
All right. So the second one is, and this is something we've already talked about before, Surgical Center of Oklahoma.
You're exactly right. You go to the Surgery Center of Oklahoma website, and on the up left-hand corner, you'll see the price, and that's the full bundle price of that procedure. That's the exact price. So you can go there, and I believe the last time I checked, the hip replacement, as an example, was around $19,000. That included everything: the OR, the anesthesiologist, surgeon's fee, all the instruments. So you can use that price as well. So that way, when you contact the hospital, you can say you have actually two prices as benchmarks.
Okay. All right. And now you've got a suggestion also for a third place to go, and that is what we've been talking about is medical tourism, going to a foreign hospital and getting their price.
That is correct? Absolutely correct. You can go online and find a certified Joint Commission certified hospital. Go to their website. It's in English. Look around. Contact them directly and say you're interested in a procedure. Let's use the hip replacement. They're going to ask you to submit any kind of x-rays or MRIs that you have. They're going to want to see a doctor's report. So you'll have to do a little bit of work up front, so that you have that information. And then once you send all that information to them, they'll have an orthopedic surgeon look at that and get back to you with a treatment plan and a price. And you're not going to be charged for that.
Okay, that was going to ask you. I mean, the only thing that you're going to have to pay is the postage or to get the information or to gather the information. But they're not going to charge you to get a quote.
No, they're not. And that's why, I don't want to give a name of a hospital here because, obviously, when you contact a foreign hospital and do that, they assume that you're intending on coming there for a surgical procedure, and they have day jobs, so they can't be just doing this for Americans all day long and not getting any patients. So, but I would certainly recommend that. So there you have 3 ways to get these prices. So when you call the hospital, now you have 3 different prices, and you can tell them, work on their sympathy a little bit and say, look, I live here in this town. I'd really love to come to your hospital and have this procedure done, but I can go to Oklahoma City and have it done there. I know what the insurance company is paying you, but I can also go to a foreign country and have it done there, and I have the full treatment plan and price quote there. And that might be a good news story for the local newspaper. Can you be in the ballpark of these price quotes that I have?
All right. You are listening to the Healthcare Secrets Podcast. I'm John Daly, and that is Judd Anglin. He is the author of the book, The Big Book of Healthcare Secrets. Judd, to me, what you just said it is so cool because it puts the onus back on the patient to be the consumer. How do consumers know, though, that these places they're going to, or the fact that they are getting a lower price, they're still going to get quality, and it's still going to be qualified medical care, and it's still going to be safe?
First of all, you have to understand, when you have a surgical procedure done anywhere, there's risks. So you want to mitigate those risks and ensure that you're going to a reputable place. So I always tell people to start off with the Joint Commission. You can go to the Joint Commission website. So just go to your browser and type in, the Joint Commission. And when it comes up, they have an international division called the JCI, Joint Commission International. And there they have a list of every hospital around the world. I think there's over 300 that have JCI accreditation. Now, they accredit hospitals on quality, safety standards, protocols. So it's quite a robust accreditation, and it does cost the hospital a lot of money to get that accreditation. So obviously they're taking the issue of quality very serious. Also, the last thing that any reputable hospital in the world would want is for some American to go there and have a botched surgery, because that could certainly be headline news around the world the next day, and that would be detrimental to their finances. So they don't want that. In fact, we've had hospitals in the past through MedRetreat, my medical tourism company, and the hospitals would not take the patient because they felt the risks were too high. Another thing you can do is when you find a hospital abroad, you can contact the embassy or the consulate in that town, the American embassy or consulate, and ask if they consider that to be a safe hospital. Do they recommend Americans to go there?
All right, cool, good information. By the way, that website is jointcommissioninternational.org, jointcommissioninternational.org, so you can go take a look at it there. What's so cool about this also, Judd, is that you need to tell the story about one of your clients who actually did this and actually helped you improve this healthcare secret. Talk about that.
Yeah, I've been in the medical tourism business now for about 18 years. And I've learned a lot of these secrets through my clients. I was working with this lady from Wisconsin one time who wanted a hip replacement. And, she paid the upfront commitment fee of $295 so we could work with her. She sent us all of her files, her x-rays, images, doctor reports. We assembled all that information and got it over to the Glen Eagles Hospital in Penang, John. I think you've been there.
Yep.
Yeah, so we sent all that information over to them, and they took about 2 days, and they came back with their recommended orthopedic surgeon and his treatment plan and the total cost for that. So I got all the information, sent it to this client, and after a week, I didn't hear from her. We were prepared to go to the next step and help her take care of the logistics like the flights and hotels and everything else. And she wasn't responsive. And finally, about 2 weeks later, she called back and she was very apologetic. And she said, Judd, I just want to let you know that I'm going to stay here locally. I got all that information that you sent me, and I took it to my orthopedic surgeon and showed him. And he said that he would do it for the same price. And I was just like, wow. I mean, obviously I lost a client, but I was like, that's amazing. that is so cool. And then I started recommending other people to do it, and they get the same results.
Wow. That's, and again, it's being a consumer. And I got to think for you, even though you did lose a client, it's like, wow, I really helped some people.
That's why I love my job, John, because there's so many more stories like that I look forward to sharing. And
we're going to share them with you as well. We're going to put all this information on our website, which is the Healthcare Secrets Podcast, which is at www.healthcaresecretspodcast.com. And you can also get Judd's book there, The Big Book of Healthcare Secrets. You can check us out on Facebook and YouTube. We are also on Twitter at Healthcare SEC, the number 1. That's on Twitter. That's Healthcare SEC 1. And you can listen to all of our podcasts on Spreaker. That is at www.spreaker.com. And Spreaker is speaker with an R stuck in there right after the P. And that is a podcasting service that we use as well. Judd, this is another good one. This is actually one of the cool ones that everyday people can do. I think it's one of your best secrets.
Well, thanks, John. Appreciate that.
All right, folks. Remember, stay healthy. We'll have more for you on the Healthcare Secrets Podcast.